structures are readily visible. We will also show how to recognize the skull, face, and structures of the brain, including the ventricles, cavum septum pellucidum, that we sometimes abbreviate as CSP, thalami, cerebellum, and base of the skull. This is a sagittal profile of the fetus. Please ask your trainer to show a sagittal position with a doll. Because the skull is bone, it is hyperechoic, so it will appear white. Here we can see the face and the skull. This picture shows the skull in transverse. The skull is oval on cross-section, and in the next lecture, we will show you how to measure the skull to determine the gestational age of the fetus. The dashed line here shows the measurement of the biparietal diameter, or BPD, which allows estimation of the gestational age. This fetus is 15 weeks and 5 days in gestational age. This is the transverse view of the head in an older fetus. In this case, the BPD measurement estimated a gestational age of 26 weeks. This is what the face looks like in profile very early in the second trimester. Which features of the head and body can you clearly identify? Please pause the video now to encourage responses from the group. Here we have labeled the skull, forehead, nose, body, spine, and leg to make them more obvious. Here is what the face looks like in an older fetus in profile, which is called a sagittal image. Can you see detail in the fetal face? Here we have labeled the forehead, nose, and lips. Now we are going to look at the brain, starting with a basic diagram. The darker gray structures in the center of the brain are normal fluid-filled structures called ventricles. The 3 lines are different levels of scans or slices through the brain. We need to know how the brain looks at each slice level because we must image a specific level to estimate gestational age, which we will learn later. We will talk about these levels more in the next slides. This is a transverse image of the fetal head at level A, which is best to see the ventricles in the brain. We can see how level A slices through the ventricles, just above the middle. The ventricles are filled with fluid, so they are anechoic or black. The echogenic material in the ventricles makes the fluid, which is called the choroid plexus. This is a transverse image of the fetal head at level B. This level is very important because we will make a measurement at this level to estimate the gestational age of the pregnancy. We will cover this in the next lecture. Level B slices through 2 structures called the thalamus and the cavum septum pellucidum, or CSP. The thalamus has a heart shape and may be easier to see if we outline it like this. The CSP appears as a small black box and is located just in front of the thalamus. Near the bottom of the CSP, it appears as 3 white lines instead of a black box. It may be easier to see if we outline it like this. The CSP may not be seen before 18 weeks gestation. This is the same transverse image of the fetal head at level B. There's another very important structure to identify, the strong white line in the middle called the falx. You can also see the falx at other levels. This structure is important to recognize because it will help to show where to make the proper measurement for determining gestational age. Let's review again the appearance of the thalamus, CSP, and the falx. The thalamus often has a heart shape, and the CSP is located just in front of the thalamus. The CSP appears as a small black box or as 3 white lines. Next, please identify the falx in both images, which is the strong white line in the middle of the skull. Please pause the video now to ask participants to help identify the falx. Here, we have labeled the falx to make it more obvious. This is a transverse image of the fetal head at level C. You will see a structure in the lower posterior part of the brain called the cerebellum. The cerebellum is important for maintaining balance and posture. It is shaped like a very fat number 8. Here we have outlined the cerebellum to make it more obvious. Then we will remove the outline to allow you to find the cerebellum in the image again. The orange line on the diagram is a transverse cut through the base of the skull. The white hyperechoic structures at the arrow are bones at the back of the skull base. Please pause the video now so that you can take a moment to ask your trainer any questions that you may have about the head or the brain. Now let's consider the heart. In the second and third trimester, you can clearly see the heart beating. There are 4 spaces or chambers in the heart: the right and left atrium and the right and left ventricle. Blood flows through the chambers and out the aorta to the rest of the body. Here is a transverse or cross-section through the chest. You can see the 4 chambers of the heart. We have placed a star inside each of these chambers to mark the location. The heart chambers contain blood, so they are anechoic. The walls of the chambers are echogenic. Here is another 4-chamber view of the heart. Can you see the 4 chambers? Once again, the stars are placed inside each of the chambers to make them more obvious. Here is a video of a beating heart in a fetus. You can see the motion of the cardiac valves in guiding blood flow from one chamber to the next. These views of the chest show small hyperechoic echogenic structures. These are ribs, which are made of bone. Please also notice the heart and stomach. Let's move now to the abdomen. These are the important abdominal structures that we will cover: stomach, umbilical vein, umbilical cord, kidneys, bladder, and spine. This is a transverse section through the abdomen. Please ask your trainer to show this slice with a doll. This is the correct level in the abdomen to measure the abdominal circumference, and we will discuss why in a moment. First, let's point out the stomach in each image. The stomach is anechoic, black, because it contains fluid. The stomach normally varies in size. Now, let's identify the umbilical vein in each image. The umbilical vein carries oxygen from the placenta to the fetus. Because it contains blood, it is anechoic. Notice the curved shape of the umbilical vein at this level. Imaging the stomach and umbilical vein together is very important because it allows us to take a measurement here of the abdominal circumference to help determine gestational age. The dashed line in each image shows the measurement taken by the sonographer of the abdominal circumference. We will talk more about how to do this in the next lesson. When you look at the fetal abdomen, you will often notice the umbilical cord. The cord attaches to the fetal abdomen and the placenta. The image on the left shows the umbilical cord inserting into the abdomen. Please pause the video now to allow participants to identify the umbilical cord, fetal abdomen, and the cord insertion site. Here, we point out these structures to make them more obvious. The image on the right shows the umbilical cord in cross-section. The cord normally contains 2 arteries and a vein. You can see the vessels as round anechoic structures. We have labeled the umbilical cord here to make it more obvious. Kidneys can be seen in the 2nd and 3rd trimesters. The kidneys are oval-shaped on the sagittal view, and we have outlined a kidney to make it more visible. On the right image, the kidneys appear more rounded on a cross-sectional or transverse view. On this transverse image, you can see both fetal kidneys. Now we remove the outlines to allow you to find the kidneys again. The bladder contains urine, so it is anechoic. It can normally be different sizes. The left image is a coronal view of the bladder. The right image is a transverse view. What do you think these hyperechoic structures are? Please pause the video at this time to allow the group to respond. The answer is that they are the femur bones in the thigh. We will talk more about bones in the leg in a few minutes. It is sometimes easy to confuse the bladder and the stomach. Both are anechoic. The bladder is low near the legs. The stomach is high near the ribs. We point out the heart in both of these images to further help orient you. Here are the transverse views of the bladder and the stomach. The bladder is low near the legs. Here we show the bladder and the femur bones in the thigh. The stomach is high near the umbilical vein. When the stomach and umbilical vein are imaged in cross-section, and the umbilical vein has this curved shape, this is the correct level to measure the abdominal circumference to determine gestational age. We will talk more about this in the next lesson. What do you think this hyperechoic structure is? Which plane is this? Please pause the video now to discuss as a group. The answer is that this is the spine and the plane is sagittal. The maternal head is to the left and the maternal feet are to the right. What position is the fetus in? Please pause the video now to discuss as a group. The answer is that the fetus is a breech. These are transverse views of the fetal spine. The spine is at the back of the fetus. In the left and right images, both spines are up. We have outlined them here to make them more obvious. The left image shows a young fetus whose spine is not well developed. The curved structures on either side of the spine are ribs. What is on either side of the spine in the right image? Please pause the video now to discuss in the group. The answer is that these structures are the kidneys. Now we'll finish with the extremities. The arms and legs are often well seen because bones are hyperechoic. Here we can clearly see the hand, forearm, and upper arm. Here is a nice image of the lower leg and foot. Notice that there are two bones in the lower leg. The larger bone is called the tibia, and the smaller bone is called the fibula. This makes it easy to distinguish the lower leg from the thigh, which has only one bone, the femur. Here's a view of the pelvis and the thighs containing just one bone in each extremity, which is called the femur. Notice that there is no second bone next to the femur. If you see a second bone, you are not looking at the femur. In the next lecture, you will learn how to measure the femur to determine gestational age. Let's review some key points. You should be familiar with the normal appearance of the fetal head, heart, abdomen, spine, and extremities. In order to accurately date a fetus, you must be able to identify structures in the brain, abdomen, and extremities. Questions for review. What are the 5 important parts of the fetus that should be seen in the second trimester? The answer is the head, heart, abdomen, spine, and extremities. Name at least 3 structures of the brain that you can see on ultrasound. The answer is the cavum septum pellucidum, or CSP, thalamus, the ventricles, and cerebellum. How many chambers should you see in the fetal heart? The answer is 4 chambers. Is the umbilical vein anechoic or hyperechoic on ultrasound, and why? The answer is anechoic because it contains fluid, which is blood. What color is the fetal spine on ultrasound? The answer is white because bone causes sound to reflect back to the transducer. How many bones will you see with the femur? The answer is just one. Below the femur, in the lower leg,